Wonderful. Well, thank you. Well, everyone, I'm really excited to be here tonight. I was just telling Tracy that I just got off a really busy day. I was in patient consults all day, and I'm super, super excited. So I'm going to try and bring my excitement down and my energy down. But I will tell you that one thing that I'm very passionate about is the patient experience. And the patient experience to me is more than, just them feeling great about the service that I've given them or their treatment results. It encompasses many different things. And today, what we're going to talk about, and this is a very interactive session, is we're going to talk about the different segments of the patient experience. And so, why does this matter? Why does it matter? It's because really the patient experience is what helps you retain patients. It helps you get patients coming back to you. It helps you get word of mouth referrals, which is really important. If a patient has a really good experience at your clinic, they will shout your name from the top of a cliff. They will tell all of their friends, they'll tell all of their colleagues, and you'll have no problem getting patients in your door without having to spend a marketing dime. The other thing is reputation. All of us really want to be respected in the industry. We want to have a good reputation. And for me, this is also really important because my name is very synonymous with very good customer care, or very good patient care. I walk my patients through everything. I have a 5-star experience with everyone. Does it make me tired? Sure, sometimes. Sometimes I do go overboard. Sometimes it dips into my personal time. But you know what? At the end of the day, I go to sleep at night and I know all of my patients are really well taken care of. And that's one of the first things I do say in a consultation is after I've credentialed myself, I always say the same thing. I say, you're in really good hands because I believe that and I know that they're in really good hands. I'll do everything I can to take care of them. That's my job. So this isn't just an opinion. This isn't just me coming up here and saying, this is what I think. There's actually many studies on this. And my background is in research. I have a degree in biology and in human science, which was actually all about research. And so research is really important to me. And this was one of these papers that I found. And this was someone's thesis, believe it or not. And one of the things that was really interesting that he quoted was it was from a book and it's called Exacting Beauty Theory Assessment and the Treatment of Body Image Disturbance, which isn't what it sounds like. It's just an old kind of title because back in 1999, we used to think that it was a body image disturbance that we needed to treat, but it's not. Now we know it's just an aesthetic indication. But in this, they actually found that patients were more likely to report satisfaction when they received comprehensive explanations and emotional validation during pre-treatment conversations, even if the aesthetic results were modest, which is pretty impressive. So even though they might not have received the treatment results they were expecting, at the end of the day, because the overall experience overshadowed this, this is what their perception was, is they rated this much higher in satisfaction. And there's study upon study that I could keep quoting you on this, but I just have to tell you that this is a well-researched topic. So tonight's journey, we are going to go from the patient entering the clinic right down to the follow-up, touch-up points that matter. And we're also going to talk about these small details, the things that make a lasting impression. And these are things that I have really found over the 30 years in aesthetic medicine. So I'm not going to give you exactly how many years because then you will know how many units of neurotoxin I have, but I've been in aesthetics for over 30 years, and I'm the founder of the Derma Room. I am the director of the laser program at the Eye Face Institute. It's a plastic surgery clinic. I'm a consultant and national trainer with a company called Excite Tech. I work with them. I also work with other companies as well. And I'm a CMLSO. I'm one of a few of 100 worldwide. My specialty is aesthetic medicine, and it is in the area of specifically a very niche which is energy-based treatments. I do not inject, and I'm not a nurse. I'm a medical esthetician. And I do believe it's really important to say that because you want to make sure that you stay in your lane, your credential, and you're happy with what you do. And for me, it's really important that patients understand that, people I'm teaching, which is one of my passions, understands that, and understands that I'm really good at what I do, and that's my focus and my specialty. So let's start off with the phone. This is the number one introduction that your patient is going to have to your practice. And one of the things I love to do when I'm teaching, and I'm teaching at a clinic, let's say they've purchased a new piece of equipment or they have some new products, or I'm teaching them advanced treatment technology, then the one thing I'll ask them is I'll say, how's your phone? Does your staff know how to give good phone, as I like to say? They're like, oh yeah, the receptionist is great. She's really friendly. Okay, well, she may be really friendly, but is she knowledgeable when you actually phone the clinic? Does she know what she's talking about? Does she use professional language on the phone? That's really important. It changes what people think. The other day, I was doing a secret shop, and I love doing secret shops. And I strongly suggest you do one, and I'll circle back to this in a second. But um, I called the clinic and the girl answered the phone, and I'm not going to say the clinic's name, but she said, yes, may I help you? And I was a little taken off guard. I was actually a little like, ooh, that's a little abrupt. And so I asked her about a particular treatment, if they offered it. And she said, oh yeah, it's a really good treatment. And I thought, okay, yeah is not very professional. Even though she was very casual, it's not very professional. We need to use professional language when we talk to customers. We need to talk slowly. We also need to make sure that when we're talking to them, we make it easy for them to book. So in this case, in this particular clinic, I said to them, is it possible for me to have a consultation? And she said, well, yeah, we're kind of booked for the next 2 weeks. And I thought, okay, well, if it's too hard for me to get in, I'm going to go somewhere else. And so it needs to be a very easy path to booking. It needs to be an easy conversation to booking. And so I'm going to ask everybody here, I'm going to say in the chat, I want you to tell me if you've done a secret shop. I want to know if you've done one. Just give me a thumbs up, give me a yeah, give me a no. And the reason I'm asking is because I'm also, as part of you joining tonight, I'm going to give you my secret phone shop guide. And it's just a little guide that you're going to use. You're going to ask your bestie to do this for you, because none of you are going to be very optimistic or very neutral when you call the clinic. They're going to know your voice. You don't want to do your own secret shop. You want somebody who's totally aside from that. And so ask your bestie and say, look, I have a job for you, and I'll take you out for a beautiful glass of wine and some munchies after. I just want you to do this for me. It's really important that you start getting some feedback on what's happening with your phone. This is your primary introduction to your patients. Now, when you do this, it's not that you're going to call these people out and say, okay, Emily, I had a secret shop and you did terrible. You were really unprofessional on the phone. That's absolutely not the way to do it. People feel like they're being spied on. What I like to do is I like to tell the staff, I always tell the staff, you guys, we could call at any time. We could have secret shops at any time. I could be secret shopped. I even have friends of friends who I have send in to secret shop me, because I want to know if there's something I'm doing that's not right. But I want them to know this secret shop is not about on Tuesday at 2 o'clock, somebody called in and I know it's Emily that answered the phone. Because chances are, if somebody has answered the phone in a specific way that is not good, it means it's probably pervasive. So that means everybody's doing that. So you just want to train everybody and just want to say this, the results of the secret shopper show that we need to kind of up it with our language a little bit. We want to use more professional language. So let's practice a little bit. Or it might even be, look, our booking process is a little cumbersome. Let's work on that together and make it more of a group environment. So then you can up your phone skills. So again, I'll be sharing that with everybody, and that will be part of the handout that's going to be available. That will be for THEMA members only, even though this part the webinar will actually be online, but that will be available to THEMA members only. Next is going to be your first impression. So your first impression when your patient shows up. So We want to talk about lighting. We want to talk about scent. We want to talk about cleanliness and order in the room. And if we look at this picture, this is a great image. And the clinic looks overall, it looks okay. It looks kind of clean, but there's dirty cups, there's dirty water bottles or used water bottles sitting there. There's maybe some water rings sitting on the counter. It doesn't look like it's a clinic. And it's really important to train the person at the front desk just to get up the minute a patient is moved, get up, clean up, tidy up after that person. Very important. And I tell you that when I visit a clinic, that's one of the first things I notice. And when I go in for training, I will mention that. I will say to them, by the way, when I came in your waiting room, there was a bunch of dirty coffee cups there. I'm not offended by it, but I just want to let you know, as a patient, the first thing I think is, that's a little bit not nice for me to see. I don't want to have to move somebody's dirty cups when I'm sitting down at a table. So think about those things. People often leave things like their sweaters laying around and things like that. Make sure it's very tidy. The other thing is signage. So I don't know how many offices I've walked into, and there's a sign that says, please sit down if the receptionist is on the phone. And then there's another sign over here that says washrooms are located that way. There's another sign over here that says, please welcome yourself to coffee. There's a lot of signs. We're inundated with signs day in, day out. Try and make your space a little more neutral. I'm going to tell you why. Because when we're inundated with a lot of signs, and there's lots of science behind this, if you're inundated with a lot of signs in the waiting room, all of a sudden you start getting anxiety. I've got to do all these rules. I have all these things. You're already a little anxious thinking about the numbing you need, the treatment you're going to have done, maybe discomfort. Maybe it's your first time having this done. All of these things. It's really, really important to make sure that you keep everything as calm as possible. It will lead to a calmer patient, especially when somebody's new in your practice and they're a little bit on the edge, right? So make sure it's nice and calming. Take a look around, sit in your waiting room. So go around that desk, sit in your waiting room. What does it feel like? And then make sure that your front desk is in order. I'm going to tell you, I'm so judgmental of front desks when I come in, but I know a lot of other people are too. And I've heard some people say things like that, oh, front desk looks a little messy, or you have post-it notes everywhere with notes for the staff. But don't forget, your patients can see all of those. So make sure that you clean up your area. Anything that's visible to the patient should be tucked away, and everything should look very orderly. If people see order, they think that you're a very orderly person. They think that you're very neat, tidy, and know what you're doing. So again, it's all about the first impression. As far as scent goes, be very careful. I've walked into some clinics, it's very heavily scented. People are very sensitive to scents. Things like incense and things like that might be good in a spa, but in a medical facility, it's not great. Alternatively, it shouldn't smell like Javex when you walk in, so it shouldn't smell like the place has just been over sanitized. So just be very aware of that and make sure that you keep on top of how the scent in the air is. If you want to get like an air purifier or something, that's also a nice kind of touch for them. As far as lighting goes, which is the last thing I'll touch on, is just make sure people are reading. So make sure there's enough light. I went into one clinic a couple of months ago and had a really hard time reading because there was no light. So just make sure that you have a lot of light visible, so then they're able to read the consents and sign all the forms that they need to sign. Big part 2B of the patient experience of first impressions is music. So I'm going to ask again in the notes. So in chat, I want to know how many of you have heard of SoCan. And I'm going to say that I don't think a lot of you have. So when you have any type of music in your waiting room, you are not allowed to just have, streaming on there, whatever you have, Spotify, or maybe you have, some sort of streaming app that you're using, or maybe you've bought some CDs and you have that going. If you have any of those going, you do not have the right to play that in a waiting room. I'm going to tell you why. So there's very specific rules around what you are allowed to share in a business. And I want you to think of it this way. Those people have gone out and produced that music for your enjoyment. And it is for you to have personal enjoyment. It is not for you to share and not have them get some sort of benefit from it. So SoCan is the regulating body in Canada that will, if they come into your facility, and they do this from time to time. I've actually had that in a clinic I worked at, and that's how I found this out. They come in and they can fine you for distributing and playing music that you are not permitted to do. You need to license it. It's not expensive. It's now they've gone up to $120 a year to license the music that you're going to be playing. So we use Spotify. You use Spotify, then you just tell them what you're using, and then they license you to do that. And then it's a nonprofit organization, and all the money goes back to the members, and all the members are the musicians. So it's a nice way to give back to the musicians as well. But make sure that you stick with music that is whatever your clinic is trying to portray. So if you are a clinic that's very high energy, you have a lot of young people in your clinic, maybe a lot of Gen Zs, then you might want to have something that's a little bit more upbeat and you like to play that type of music. That's great. You might want to have something that's a little bit lower mood if you have a lot of patients around the Generation X, then you might want to have something that's a little bit lower in mood. It depends too on the type of environment that you have too, whether or not you just play music straight through, or you just have something that's instrumental. That's sometimes a little bit easier. Also relaxes people if you have something that's a little bit more relaxing. But just remember, you don't want anything that has news and commercials and things like that, because there's nothing worse than listening to the tariff war while you're laying there getting some services done. That's really kind of horrible. So just keep that in mind, saying that because that actually happened to me. Next, we're going to talk about the greeting. So the greeting is really important. And this, we think we take it for granted. We just think it's like, hi, how's it going? But you know what? It needs to be warm, and you need to speak with your reception staff and make sure that if they're on the phone, because oftentimes they double duty, they're so busy. They see our patients twice as much as we do, and they're really busy. And sometimes when somebody comes in, they're kind of like, oh, yeah, off the phone. And that's not really a nice greeting, right? Now I feel like I'm sort of bothering you. So it's how to deal with that when you're on the phone. And oftentimes it's just a matter of tilting the phone a little bit, saying hi, and just saying, or motioning to the seating area that they can have a seat, and you'll be right with them. Make sure that you make eye contact. They have to make sure that they're smiling, and be aware of any conversation at the reception. This happened the other day when I was in a clinic and I was listening to the entire drama unfold about a patient and some situation that happened between the provider and this patient. And I was listening to that while the provider was telling the receptionist at the front desk. We have to be a little bit more cognizant of that, even if they're speaking in different language. Remember, some of us speak 2 languages, or even 3 or 4. So make sure that you're very careful about what conversation goes on. That includes eating too. Oftentimes I go in and I'll see people eating at the front desk. This is an absolute no. Does not lead to a great patient experience. Obviously, you can have your coffee, you can have your tea or a beverage, that's fine, but make sure that there's no food at the front desk. It's an absolute no. It also looks a little bit messy and dirty to do that. Privacy. This is very important. Privacy is part of the greeting. When a patient comes in, the last thing you want to say is, hi, Tracey, how are you? Long time no see. Maybe I don't want everybody in the waiting room knowing that I'm Tracey. Maybe there's somebody in the waiting room that knows me and now all of a sudden is alerted to my presence and is looking up at me. Do we just have to be very mindful of that? The other thing is to call people out during their time in the waiting room to come back and walk with you to the treatment room. Oftentimes I see this, they come out and they'll say, oh, hey, Tracey, hi, come on back with me. No. We're medical. We should know better than this. We know better than this. It's privacy. We really need privacy. And so walking up to a patient, taking 2 seconds just to say to them, Tracey, very softly, Tracey, I'll take you in now. So it's very, very quiet. And that's what's really important. We really want to make sure we respect our privacy with patients. The other thing is at the front desk, we have to be very careful when the patient comes in. We say, oh, hi, Tracey, it's nice to see you. Joanne will be right with you for your toxin treatment. Not everybody needs to know what I'm having done. So we have to be very careful as well, speak with our reception staff and our treatment staff and say, we need to be very cognizant of what we're saying to our patients when they first come in. You can say it very discreetly. You can also, what I like to do is I have everyone sign in, and when they sign in with their consent form, it says right on it what they're having done. Just confirm your treatment for today for me when you're reading your consent. Very simple, very, very simple. Now, the next thing is the waiting room. You want to make sure that it's very, very comfortable. There's lots of seating. You have hydration there, whether it's some sort of water, coffee, tea. I've seen some beautiful things with sparkling beverages and things. That's great. You want reading materials there. It can be things from your clinic. It can be specific fun things for them to read. Make sure that all the magazines aren't old and dog-eared. These are things that, again, reflect your entire clinic. The Wi-Fi is really important now, and it used to not be, but now very important to have a little sign up that has the Wi-Fi password or Wi-Fi accessibility. People really do like that, especially if they're going to be waiting for a little while. And make sure it's not overcrowded. So this is really making sure that you know how to triage your appointments. If you have, let's say, 10 patients coming in and 9 providers, you know that you're going to be able to take people in, and you might have to take one person and put them in a separate room to maybe numb or whatnot, and not have them waiting in the waiting room because you only have 9 chairs and 9 people that are going to be going in. So make sure that you're planning appropriately for the number of people in the waiting room. You want people standing because there's not enough room. That always leaves a bad impression. It looks like you don't know how to book properly. So always make sure you have enough seating for who's booked. Now, the other thing is you'll notice my picture on the right-hand side has that big board up. And, we do that in some clinics because of, protection if you want. And that's certainly, it's up to you if you have that in your clinic, but just make sure it doesn't feel so much like you're going to the DMV. So you want to make sure that you don't have signage all up on the outside of that, and, just kind of a little tiny slot like we used to have at the bank to put, just change under. You want to make sure that you have enough room under there to appropriately put the forms underneath that you would have signed, or the iPad underneath to be able to have it signed. So all of these things you want to take into consideration when you have up those protective safety barriers as well, if you do have them up in your clinic. Now we're going to do a little bingo. And so what I'd like everyone to do, I want everybody to read through these 9. And in the comments, I want to know if anyone has actually reached 9. And I'm going to tell you why, because I actually have reached 9, which is really scary going into a clinic where I've said, oh my goodness, I actually have had 9 of these things happen to me in a clinic. These are all things we really don't want to see, and we don't want to be running into. So I want you to take a look at this and just tell me whether or not you've run into this, if you have had any of these. So loud music when you go in, you found yourself that you were told to walk down to the treatment room. Go ahead, Joanne's waiting for you at the end of the hall. Or your name's shouted across the room. Or the receptionist is eating lunch at the desk. Sorry, I'm just grabbing lunch. I'm a little hungry. Or there was a smell of disinfectant throughout the reception area, and you're like, oh, wow, what happened? Or overhearing conversation at the front desk between staff, which is sometimes kind of fun, but really shouldn't happen. Half dead flowers in the reception area. So all of these things. And I hope that you haven't had a full 9. I hope that you've only had a 4 or a 5 or a 3 out of these. But out of this bingo card, if you are even getting 1 or 2 out of your clinic, you really need to make sure that you clean that up. It's very important that we change that to really elevate that patient experience. Now, when we're looking at the room escort, which is what I just mentioned, this is something I'm really passionate about, because I don't like when my patients just wander down the hall till the end of the hall. And our clinic, we have actually lots of little different hallways that they can wander down, and who knows where they can end up. But even if it's a straight hall that you wander down, it still feels a bit like a cattle call. Tracey, yeah, come on up. Go ahead down. Joanne's waiting for you at the end of the hall. It doesn't feel very welcoming, doesn't feel very nice, especially if my treatment's going to cost me $2,500. I think the person can walk me down the hallway at a gentle pace. And I'll tell you about an experience that I had that was really nice. Is I went to a clinic, And it was my first time there. I was actually having a treatment, and they came up to me, said very gently to come down the hallway with them. She walked down the hallway with me. As we passed every single room, she said to me, "This is our room where we do XYZ treatment. This is a room where we do blah, 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 blah. Oh, this is," and I can't remember her name, but it was like Marguerite. And she takes the photos in the clinic. And I said, "Oh, hello." And she says, "Oh, hi, I'll be taking your before and after photos." And then she walked by. Every single person and space we walked by, she would introduce where it was, even when the door was closed. All of a sudden, I knew everything they did in the clinic without her even having to sit down and tell me, because she walked me through. It was such a nice experience, and it's something that I've carried with me and I like to do now. And so if you can bring that in, that just elevates you just a little more. Also saves time in your consult, because now you've already told them half of the things you already do in the clinic. Now, when we look at the treatment room and the first impression, this is very important. Never bring a patient in when your room is unclean. It still has paper and dirty linens on the bed from your last patient, whipping them off and saying, "Oh, go ahead, have a seat. I just changed that." People don't like to see that. They don't want to see that. Also, make sure that there's visible sanitation in the room. So they should be seeing that you have your cavi wipes out, you have your alcohols, you have all of your things out. They should also have a very professional feel when they look at your room. And this is part of it, is the back bar. So when you look at the back bar, if you have, obviously you'll have half open bottles, and that's fine, but you shouldn't have tubes of things all sort of squished down like a tube of toothpaste, and the top of it's dog-eared and half of the stuff is coming out, and other types of bottles that have product running down it. And these things just don't look good. And you know what? People do notice. It's really important to keep everything very, very clean. That's why I like to keep things in cupboards too. As much as I can, I keep things pushed away, and I only have out what I need on my Mayo stand. It just makes it so much more professional. There's also the power of displays when you have a back bar. And so if they can see, if you do have your back bar out and you do have some beautiful products you'll be recommending to them, it's really nice to have them look nice and have them sitting there, because then people are appealing, they find it very appealing, and they will want to know more about them. They'll want to buy them. The last thing you want is things that don't look very nice and don't look sanitized. Now, when we talk about you in the treatment room, one of the big things that drives me crazy is when the bed shakes. You're going to say, "What are you talking about?" People do this constantly. And I want you to catch yourself when you do it. When we're talking to a patient, it's very, very common for us to either lean on the bed, stand against the bed, hang on to the bed, and even during treatment. During treatment, I find people tend to shift their hips out, they push their stomach into the bed, and now they have the bed sitting on their belly. I don't know why we do this, but I'm going to tell you, when a patient's on the bed and the bed shakes, it doesn't feel good. It's not a good experience. Also, it's really not good for accuracy, whether you're injecting or you're delivering energy-based medicine to the treatment area. It's really not a good practice. So I want you to start making sure you're not leaning on the bed and you're away from it. You give them, again, a great patient experience. Make sure that when you're using rolling chairs, one thing I see a lot is we tend to have our patients sit into the lounger and then we roll up to them on the chair. It's not very professional. It's fun, but it's not very professional. So make sure, if you're using a rolling chair, you pull it up and you sit down. We're not in school anymore where we can roll back and forth on these things. It just doesn't look professional. Make sure also your posture. So when you're talking to them and you have confident posture, they do feel that you know what you're talking about. And so one thing that you'll want to do is make sure that you're aware of how you're standing, and make sure that, you're not sort of slumped over, kind of leaning on something. I had one treatment provider, she was standing and leaning against the wall with her arms kind of, folded. All of those things change the perception of what the patient feels that even though you might be the greatest treatment provider ever. You want to also respect their space. So I have had instances where I've been training and I've been like, "Whoa, guys, you got to remember, this patient doesn't know you, and all of a sudden you're leaning in their space." That's not very good. You want to make sure that you let them know. When I'm looking at a patient and they first sit down in my chair, I always tell them, I'll say, "Okay, today what we'll be doing is we'll be doing a radio frequency treatment on your skin, and I'll be delivering some energy in your nasal labial folds. Do you mind if I just show you where I'll be treating?" Now, you see how I've told them where I'm going. Do you mind? So I'm leaning in. Do you mind? It's really important because then I'm asking you, is it okay if I come in your space? It's not great if I just lean in and start touching you and telling you what I'm doing. Again, it's a little startling, changes their perception of how they feel about the treatment. You want to also make sure that you have props available. So you have all sorts of things like Brio boards. I was just talking to Tracey about Brio boards today. You also have your anatomical models. Have all of these things available to you and show them and use them. People love these things. Don't forget that you describing something to them is great, but if you can actually show them with an anatomical model and be more educational with them, make it an educational experience, you will find that they are happier with the results in the end. That is a clinical study that you can read all day long. There's tons of evidence on that. The more you make it educational for them, the happier they are with the results. And then remember, if their eyes are covered, always introduce what you're going to be planning to treat. So especially with myself, I often have either their eyes covered or I have intraocular shields on and they can't see a thing. So I'm not going to just start touching their face. I'm going to start telling them where I'm going. I'm going to be treating your forehead now, okay? And I always make sure that they understand, where am I going on your face? What am I doing? So they're not surprised and they feel very confident and very comfortable with me. One thing I don't like is I do see a lot of people count down. Okay, 1, 2, 3, I'm going to fire. Oof, nobody wants to count down. So normally what I do is I usually ask you not to count down unless you want to ask your patient, do you like a countdown? If your patient loves a countdown, then go ahead. But I really don't like the countdown. I like to just place the applicator on the skin and say, I'll be firing now, and what it's going to feel like is XYZ. I wait for them to confirm, okay, and then I fire. It's a little easier than 1, 2, 3 and start firing and the person starts jumping all over my back. Now, great expectations. This is really important. I actually love this picture. And the reason why is because it's really important that when you're outlining the procedure and you're going through everything with them and you're starting to talk about contraindications and you're reviewing their medical history, if you talk to this patient 2 months ago, you do not know if they have suddenly decided to take up smoking. And I know it's crazy, it could happen. I just want you to be aware of that because I'm going to tell you of an experience that I had. A patient, she was coming to me, she was getting erbium resurfacing. First treatment, totally fine. Second treatment, totally fine. Third treatment, not so great. And I was like, whoa, why isn't she healing very well? When she came back in, she said to me, well, it's probably because, I started sort of some recreational drug use. And I was like, okay. I was a little surprised, she was a lawyer too. I was a little surprised to hear this. Because she was such a by the book person and all of this. And I was like, oh, okay. And we talked through it a little bit and I realized that she had a compromised lifestyle. And so her skin was going to take a lot longer to heal. Now, the thing is even though I went through the medical history with her again, and I went through the contraindications, and they do that every single visit with them, no matter what, even if it was a week ago that I saw them, I still go through it every single time. I still skipped that question because she said she didn't smoke. She said she didn't do any recreational drugs. She said she only drank occasionally. So I didn't think those things changed, but they do. So now I always ask them, you haven't taken up smoking, have you? Nothing's changed? Okay, still up to 2 glasses of wine a week? Okay, great. Anything last night? So now I make it more of a conversation. And it just helps me to make sure I can manage those expectations of how long the downtime is. I'd like to outline as well, when I talk about expectations, like to outline the procedure itself. So then they understand the procedure, because what they expect from a procedure is often different than what we're actually performing, because they might have seen something on YouTube or on TikTok or whatnot. It's totally different than what we're doing. And so we want to make sure we outline the procedure to them so there's nothing unanticipated. You also want to do a little bit of an invite of questions. And so what I like to do is, as I'm telling them the procedure and I'm outlining things, or I'm asking their medical history, I'll say, do you have any questions before I keep going? So I asked them a little at a time rather than waiting till the very end and then, do you have any questions? And now we have a 2-hour conversation. So I'd like to ask them as we go, just invite some questions. Do you have any questions so far? Anything that I'm not covering that you want to review with me? And then before I start treatment, here's a big thing. I want you to review the post-care and the downtime verbally. The reason why is because after a procedure, sometimes a person is medicated. Sometimes they're just a little bit like, ooh, just got down off a little bit of anxiety and they're not listening. And now you're trying to review post-care with them. When you do it before and then you do it again after and you give them written post-care instructions, you're going to find they retain it better because you've said it twice and given it to them once. So it's a lot better and you'll find more compliance with post-care if you do that. Now, next, I want you to think about educating. This is the most important thing that you're going to be doing in the room. I know we all like to chat with our patients. We want to hear about their lives. It's really important. We want to hear about their dogs and their divorce and all of that. It's fun. But we also want to make sure that we are educating them. This is really important because when you start to educate, that's where you get a lot of power, a lot of respect, and the person now looks at you as, this is the person that's going to solve my problems. This is the person who I want to go and see because they know what they're talking about and they're going to help me. That's what you want. You want the person to have confidence in you and understand that you know what you're talking about. As well, sometimes during those conversations, you're going to start getting some more information from them. This isn't a sales pitch, it's just education. So you might be doing, let's say, a microneedle on someone, and they came to you because they don't like their fine lines and wrinkles, and you're doing the microneedle and you're talking to them about what it does, collagen induction therapy, blah, blah, blah. And then they say to you, well, that's really interesting. Will it also help with my pigment? Bing. Well, they never mentioned that during their consult, but now all of a sudden it's a conversation you can have and you can talk to them about what you can do. Now you can recommend other things that will help them. Maybe that will be something topically that you can apply at home for them. Like maybe they can use a hydroquinone in between treatments, or maybe it's some other treatment that you can provide them, maybe an IPL or an RF microneedle or something like that. Anything else that you are able to provide them that will be able to address now that new indication. Also, you can save yourself a little time in having that patient a little bit disheartened when they finish their treatment and you've just talked to them about their lives and they haven't mentioned that to you. And then all of a sudden they say, oh, you never addressed my pigment. And you're like looking back at your notes thinking, well, you never mentioned it to me. Well, that's because you were too busy chatting about other stuff. So you can still chat about those other things. And sure, it's great to cause a connection between your patients. But remember, at the end of the day, we're not there to provide therapy in that sense. We are there to provide therapy on their skin. So we really want to keep it professional and try to find out what other problems or indications they might want treated. And always try and incorporate those little teachable moments whenever you are able to. Certainly, like I said, don't stop them from talking about personal chatter. But again, you might want to try and steer the conversation to something a little bit more productive. Now, when we talk about sensory inputs, this is how they feel about their surroundings, which is really important. I'm not suggesting at all that all of you get out your singing bowls and you start, chanting and creating this spa environment. But what I am saying is 9 times out of 10, people will remember things by smell and sound, especially if they have an absence of sight, meaning that their eyes are closed or they have their eyes covered. This will play a major role in how they remember their patient experience and how they remember things in your clinic. So keep that in mind. And I want you to think of things like when you're going to, and they have their eyes closed, and you're going to be applying something on their skin. If it has a strong smell of, let's say, alcohol, or it has a strong smell of something that isn't pleasant, you want to tell them first. Don't just put it on their face and they're like, oh, that smells yucky. So you want to tell them first, this is going to smell a little bit strong, it's acetone, or this is a little strong, it's alcohol. So you want to tell them what it is. So then they're aware of what it is when you're putting it on. Or this has a strong smell of whatever plant, mint or whatever it has. So then they're aware of it. The other thing is sound. So be very aware of sound. And remember, especially if you're doing any energy-based treatments, you have a lot of devices going all at the same time. There's a lot of sound going. Whenever you have an opportunity to shut something off, put it on pause, put it down, any of those things, it's really important. Now, when we talk about sound, the other thing is the sounds our machines make when they're in treatment mode. So patients get used to hearing things, and oops, sorry, I don't know what happened there. Patients get used to hearing things. They get used to hearing the sound of the machine. So the machine may go beep, beep, beep. So when you're delivering your energy, if all of a sudden you sort of double click on something, it'll go beep, beep. And then the patient's like, oh, what was that? Don't forget, they're going to hear more because they can't see. Be very aware of that. So be careful when you're doing your treatments, not only for safety, but also for sounds, because they will know if you double pulsed on something. They will know if you did something that you weren't supposed to because they can hear it. So be very conscious of that. Now, when you're managing these senses, the easiest thing to do, obviously, is small things. Smoke vac, it's not only necessary, but it is a regulatory requirement in Canada that you have a smoke vac whenever you're delivering an energy that is causing plume in the air. You want to make sure that you spray something in the air that will also kill viral and bacterial matter. So something like HOCl. And then also you want to think about the machine noise itself. And when you have the machine on, if you're shouting at your patient, it's not very nice. Not to mention if you don't have a mask on, which you should, but if you didn't, you'd also be spitting on them, which isn't very nice. So just make sure that you're not yelling over machines. Just speak when you're needed, right? That's what's really important. And then, of course, announcing where you'll be moving to another area, because again, if they can't see, their sound, their smell, and also touch is very important. And it's something that they're going to be very aware of, hyper aware. So when you move to a new area, let's say on their cheek, they're going to jump. So let them know where you're going. And then, of course, any sensations. If they're going to be feeling something that you're putting on their skin that's going to sting, itch, or burn, or have a very powerful or different scent, make sure you tell them. Very important. And that's how you manage all of those senses for them. Again, managing their experience in your room, which is really important. Now, I'm going to talk to you about a sensory challenge. What I'd like you to do is I want you to close your eyes. And I just want you to think back to the last treatment you had in a clinic, whether it was your own or it was another clinic. And I want you to think of the smell, and I want you to think of the sounds, and I want you to think of the touch, not the treatment itself, just touch in general. And I want you just to share it in some of the chat. I want you to tell me what you can remember from that experience. Do you remember the smells that you had in that room? And I can remember my last treatment, what I could smell, I can still remember it because she was using a lot of alcohol. And I was thinking, why is she using so much alcohol? So she was using a lot of alcohol. I remember the sounds because I could hear in all of the rooms, excuse me, on each of the sides of the room I was in, I could hear all the chatter in the other rooms. And then the other thing is with touch, I could feel her moving around. She kept kind of banging into the bed. And I was thinking, that's kind of a little jarring. So I'd like to know from you guys, things that you have also remembered about those experiences. Because when you start remembering that, I want you now to think back to that treatment itself. Did you remember more of the sensory part of it, like I just did? Or did you actually remember the treatment itself? Because now when I'm thinking about that treatment itself, and it was an injectable treatment, when I think about that treatment itself, I actually don't remember a lot about the pokes. I just remember a lot about what I was smelling and hearing and the touch. So really that changes your patient experience so much. And I hope that that sort of brings it home a little bit more for you. Now, when we talk about managing discomfort, which is really important, and patients are going to feel discomfort with us. That's part of our treatments, unfortunately. When we initiate something and we start to do something, we want to tell them before they might feel pain. So during this treatment, there might be some discomfort. I'm going to be keeping an eye on a few things for noticing whether or not you are in discomfort. And I'm going to be asking you along the way, do you feel any discomfort on a scale of 1 to 5 or a scale of 1 to 10? Can you tell me a little bit about how you're feeling? And so I'm already initiating with them that they might feel some discomfort, that I'm going to be looking for visual clues for their discomfort. And I'm also going to be asking them. Now, I like to use a scale of 1 to 9 because a scale of 1 to 9 is a little bit broader. So if I said to you, on a scale of 1 to 5, how uncomfortable is this? It's really easy for you to say 3. And now I'm like, is that bad or is it good? But if I said on a scale of 1 to 9 and you said 3 or 4, now I know it's on the low side and you're okay. So I like to use a slightly broader scale because it gives me a little bit more leeway to play around with to really understand. Now, I have had, actually recently too, a patient who told me, she said, this is an 8 out of 10. And I said, okay, well, I gave you a scale of 1 to 9 and it's an 8 out of 10. I get it. It probably does hurt. But number one, she wasn't clenching her fists. And I had given her a squeezy ball. Number two, she wasn't moving her legs or her toes at all. She wasn't moving around. She was actually complaining about something else that had happened during the day. So was it really an 8 out of 10? Probably not. So I said to her, okay, well, we can kind of, back down the power a little bit and we can see how you do. And she said, oh, no, don't do that. I want to make sure I get the best result. I said, well, even with less power, we'll still get a good result and you'll still be very happy. I promise. We'll still get a really good result. She said, okay. I actually didn't change the thing. I just kept going on the treatment and she was fine. She said, oh yeah, that feels a lot better. I thought I didn't even have a chance to turn it down. So sometimes talking your patient through it, or even just taking that 2 seconds of chatting with them for a second and starting over, it will bring it down. If you've noticed that there's no physical cues to pain, but other physical cues of pain that you really do have to notice is, like I said, if they're clenching their fists, they're starting to scrunch their shoulders up, they're starting to move around, they're moving their toes around, they're kind of jiggling their legs. These are signs that it's probably a little more painful than what you really want it to be. Now, in some cases, it's just for a few moments. I know with those of you who are injecting, it's only a few moments of discomfort. They can maybe make it through, but certainly with an energy-based treatment, the last thing you want is to start the treatment and they say they're a 9 out of 10 or an 8 out of 9. And you're sort of like, ooh, okay, I've got to get through the rest of this treatment. So really kind of keep an eye on that and then manage it. And how we manage that is we manage it with different things. So we can manage it with like a Zimmer. So those coolers that we have, certainly blowing air on the area can make it feel better. Not if it's something that has already been created. Like if you've done an erbium or a CO2, do not put a Zimmer on the area after. That's going to make it way worse because cooling the area after it's been ablated makes it actually feel a lot worse. Stress balls will really help. So letting them squeeze things. Also vibration tools like you already have, those really help. And they help as well during energy-based treatments because again, it's that pain gateway theory that we're using to try and distract our patient from the actual discomfort they're feeling. I like using cold instead of ice. Ice, I find, will make the area feel worse. You can also cause burns with ice, obviously, by leaving it on too long. So I really do prefer to have something that's cold. And I'm talking about fridge cold, not something that's freezer cold. And then, of course, topicals. So you have your numbing creams and things like that. Be very careful with numbing cream because the one thing I have seen a lot of recently is people leaving it on for too long, thinking that the longer I leave it on, the better. And that's not the case. There is a tipping point in which the chemical starts to change and you can cause a chemical burn on the skin. And it literally looks like a burn. So make sure that you're not leaving it on beyond what it is prescribed to be left on. And then oral meds. There is a big responsibility with this, and make sure that if you're doing nitrous or any oral medications, that that person has somebody to drive them home. You don't want to just be throwing them in an Uber and hoping for the best, because if something ever happened, not only would you not forgive yourself, but you're also responsible for them. So make sure that you have that all documented and arranged for them ahead of time. And, you know, I've even, I had a case where I heard that the doctor was so worried about the patient because he didn't realize she didn't have a drive home that he actually got in the Uber with her and went home with her and then took the Uber back. So, you know, that was a very responsible individual who did that. But certainly I don't expect you to do that, but make sure that you speak with them before you give them any sort of medication prior to managing their discomfort. Now, before they leave, and this is important as well, as before they leave, make sure that you give them those written post-care instructions. You can certainly email them if you like to be digital, that's great, but I like to give them to them because the last thing I want is somebody to go home and not know whether or not they're supposed to put on this cream or they're not supposed to do that or whatnot. I like to give it to them. So remember, I do it before I do the treatment and I go through that written instruction card with them. Then when they're done treatment, I again go over it. Well, let's go over again your post-care. And then I give it to them. And I always say, just repeat it back for me so I know for sure you know what you're doing. It's not that I don't trust you. It's that I want to make sure that we do the right thing. I want you to heal really well. And I have them just tell it back to me. Again, it's that repeat back education piece. And then I always confirm, I follow up. This is really, really important. I follow up with a text, an email, a call, and I ask them, I'll say, I am going to be following up with you. Can I follow up with you by text, email, call, whatever you normally do? Now, I want you to remember too that across the generations, and I actually have a talk tomorrow night about generations, but across the generations, we like to be followed up in different ways. So, you know, your Gen Zs certainly don't want to be having a phone call. Lots of studies say that the Gen Z generation is actually very, you know, anxious about receiving phone calls. And so we don't want to be certainly calling them if they're feeling anxious. We want to ask them, would you prefer to receive a text? And the text can be certainly a follow-up. You could also ask somebody like myself, a Gen Xer. We love phone calls. I love whenever my phone rings. It's great. Go ahead and phone me. Then certainly you can say, would it be okay if I give you a call, Tracey? And then also email is an option. So I have some patients who prefer email. Now I give all three options. So I'll say, which do you prefer that I would reach out to you? And I'll tell you my secret formula for follow up on the next slide. But I'll say, I'll be following up with you. Do you prefer text, email, or call? And I give them the choice. So they can choose. I don't mind any of them, and I will do all of them. Some of them are easier than others. Emails certainly are easier because I can time it. I can set it in my timer so it goes out at a certain time. But certainly I'm happy to do a call as well. And then I walk them out of the room. This is really important. The other day I was at a clinic and when we were done, she was like, okay, see you later. And I was like, bye. And I was kind of waiting for her to walk me out. And she was like, oh, you know where the door is? It's just outside and downstairs. I was like, okay, bye. It felt a little weird. So it's really nice to just walk them out, at least the room door, and then walk them to reception is even better for a handoff. But you can certainly walk them at least to the treatment room door. I think that's a nice way to finish everything off and make sure that they understand, okay, this is where you go. And it's just, again, taking care of them. Everyone likes feeling taken care of. Now, this is my 5-star approach to follow up. The evening of treatment. So let's say I performed an erbium on a patient tonight. I love erbium. I do loads of them. And if I do an erbium on someone, it was quite aggressive, let's say laser coring treatment, I'm going to follow up with you tonight. Tonight, I'm sending you text message, calling, emailing, whatever you preferred. And I'm just going to say, hey, Lori, is everything okay? Just checking in with you, how you're progressing, how you feeling. You know what? They love that. My patients love that. Now, if it wasn't so aggressive, then it's going to be the next day. But before they have an opportunity to contact me, if it's by email or text, I'm going to send it right away. I'm going to send it first thing in the morning. I roll out of bed, I grab my tea, I come to my desk and I press send. And I just make sure I get that off so they have it. Now, if it's by phone, it's 9 a.m. And I just schedule myself enough time in the morning to do all of my phone calls, just to make sure that I do those phone calls before I get into patient treatment. And then I always ask for photo progress. So I might send Lori a text message and say, hey, just checking in to see how everything's going, and wanted to just see if you could send me a quick photo in the morning. Just make sure it's through natural light. I'd just like to make sure that I'm seeing what I'm expecting. Very quick, just to see if I can get some progress photos. And then again, I always confirm post-care. So I just want to make sure you're really applying that HOCl every hour, like I said, or every 5 hours or twice a day, whatever my recommendation has been. And then I do follow up daily in the morning at the same time every day until they're healed for more advanced cases, or every 3 or 4 days until the initial follow-up comes through. Now, if it's something that is going to be a very minor procedure, so let's say I'm doing something like a small peel, or I'm doing just a dermal planing or something very, very, very mild, maybe even a lymphatic drainage, then I would still follow up with them the next day. And then I know I don't need to follow up with them again because there's really nothing else for me to follow up on. So the follow-up is always based on the severity of the treatment itself. But that doesn't change from treatment to treatment. So even though I've seen this one patient multiple times, I don't start following up with her less because I know she heals quickly. I still follow the same process. So she knows I'm very reliable. And I find that by doing that, it's really, really made me the type of person that the patients want to stay with because they know they can rely on me, which is really important, that they feel, I know every time Tracey's going to follow up with me and she's always going to be there. Now, there is an issue with this approach. If you have multiple people in your clinic, which we have, if the rest of the team doesn't follow this same standard, it's going to seem inconsistent. So people are going to say, well, it's great, Tracey, that you follow up with me, but Jackie isn't. And so I guess Jackie doesn't care. Well, that's not true. She does care. She just does her follow-up different. So you all have to sit down and say, okay, how are we following up with patients in this clinic? We're going to all do it the same way. And we have to follow the same process. So then nobody looks like they don't care. It just is a different process, but we all have to follow the same process. And it needs to be clear, and it needs to be clear for every patient every single time. Now, something will go wrong. Inevitably, it does. Whether it's the treatment goes wrong, whether their appointment gets mixed up, whether nobody followed up with them, whether they got the wrong post-op instructions, or whatever it is, something's going to go wrong at some time. Because guess what? That's life. But no matter what, the most important thing is to apologize for it. And I've always found that I've found that it's humbling, yes, but you need to say, I'm very sorry that this happened. I'm very sorry that you received the wrong instructions. Stay calm. I know sometimes, especially when something really big goes wrong, literally your stomach drops. You feel like you're going to die, and you're like, should I even stay anesthetic medicine? I mean, you just dramatize the whole thing. Just stay calm and then offer a solution. And hopefully there's one available, but offer a solution and say to them, I will get you those instructions right away. I'm going to send them over. I'm going to courier them over, whatever it is, whatever happened. You know, your appointment got mixed up. I'm going to move patients around to accommodate you. I'm going to send you to Diane. She is, you know, one of my colleagues. She's fantastic. In fact, I get my injections from Diane. So you can see Diane for sure, and she'll be able to see you at the time. I'm very sorry your appointment was mixed up. You know, apologize, come up with a solution, and be with them. And like I said, stay calm, because this will go a long way to a patient having a negative perception of what's happened in that patient experience than them all of a sudden saying, oh, this was a terrible experience. I'm never going back to that clinic again. And other things that can go wrong are things that are out of your control. Maybe all of a sudden, and this happened, you know, a couple of weeks ago to me, we were in the middle of a treatment and the people upstairs started drilling. You know, I mean, we all apologize to the patient. We're really sorry. We don't know what happened. We don't know why all of a sudden they decided to work on the floor during your treatment. And, you know, apologizing for that just went a long way, because that patient was like, yeah, those people are so irresponsible upstairs. She didn't blame us for it. But if we didn't say anything, or we just complained along with her, it might have changed the entire situation. So think about those things when things go wrong and try to navigate through it, being calm and offering a solution if there's one available. So we're going to play a little bit of a game right now. I'm going to call it lightning rounds. And what I'd like you to do is in the chat, I want you guys, because I have some things here that I'm going to read out to you. I want you to give me a thumbs up or a thumbs down or a yes or a no. So yes means this is really good. This is gold star. No is it's a red flag. So opening the door when the patient first walks up to the clinic. You guys think that's a thumbs up or a thumbs down or a yes or a no? Answering the phone when it rings, when you get 3 rings within that first 3 rings, do you think that's like too much? Or do you think, yeah, that's really good customer service? How about telling patients when the treatment room is where it is and just saying, oh, it's just down the hall and to your left. And the treatment provider is in there, by the way, she's waiting for you. What do you guys think? You think that's good service? Or you think that's efficient? Or do you think that that's probably a bit of a red flag? How about passing the patients off to reception? And this one I see a lot, so that she can answer their questions on all of the products that you have recommended. This is Daisy, and she's going to be able to tell you all about this cleanser and also this night cream that I've recommended for you. Just have another patient. I'm running a few minutes behind. What do you think? Is that gold star, or do you think that's red flag? How about offering to put patients on a waiting list if they're the day that they want to come in is booked? You think that looks good? Or do you think that that's a little bit of a red flag? So think about that one. And then how about giving patients a number to text if they want any follow-up, if they have any issues? So I've had this quite a bit. Oh, my patients, I give them a text number. So, if they have any problems, they just text this number. So do you think that's like gold star, or do you think that's a bit of a red flag? And then how about forgetting that the patients have a follow-up date just this time? Just this time, is that something that you would think is a red flag, or do you think that's a bit of a gold star? Like, well, it's okay. We already know that patients, it's okay. Or how about if the patient cancels? Do you follow up with them, or do you just sort of say, well, they canceled, so they're going to reschedule at some other time? So is that a red flag, or is that going to be gold star that you call them up and say, I noticed you canceled? How about giving patients product samples in your bag? So I've seen this lots. Here's a bunch of samples. These were great. I got these from my rep. And then sending them home with those with no instruction. Are they even good for the patient? Is that, again, nice to give to them and a nice add-on, or is that kind of a red flag? And then how about replying to patient emails within, let's say, about a week? Do you think that that's good enough, or do you think that a gold star would be within 24 hours? So I'm going to open up the chat right now, and I just want to see some of your comments and see what you guys are saying. If you guys are saying no, 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 yes, no, obviously no. Exactly. Exactly. So I wanted to open up the chat now and see what you guys are thinking about what I've said tonight. And if you think that these are some things that you'll be able to improve in your practice immediately going into tomorrow, if there's some things that you would be able to bring to the table and say, I'm going to elevate the patient experience by doing the following things.
Before we do that, Tracey, I'm going to stop the recording.
Yeah.
As people ask questions. So thank you so much. This was awesome. So I will end the recording, and then we'll start with the questions.